I saw a rheumatologist who fortunately did a very extensive evaluation and thorough physical exam because I no longer could touch my thumb to my forearm without hurting myself at that point. So it was very, very reassuring to know that there was something that could explain my lifelong symptoms. Made me feel very validated.
Hi, and welcome to the Bouncing Back podcast. I'm your host, Melissa McCurley, and after my own journey with autoimmune disease, I created this podcast to share tools, strategies, and inspiring stories for other professionals who are navigating life and business with chronic illness. And if you haven't yet joined our Facebook community, please check out the Bouncing Back podcast, where we continue this conversation. We have a very special guest today who I'm so excited to introduce you to, Dr. Linda Bluestein. She's an anesthesiologist, a specialist in hypermobility disorders and performing arts medicine. And she works with people who have Ehlers-Danlos syndrome, POTS, and MCAS. And she also is the host of the podcast Bendy Bodies. So welcome to the show.
Thanks so much for having me.
Yeah, thanks so much for making time to be with us today. So you have such an interesting story from your background as a dancer. I'll let you get into that. And then moving from that into this kind of medicine. Can you share a little bit about that trajectory?
Sure. So I grew up really, really, really wanting to be a professional dancer and just loved ballet so much. And I started getting more and more injuries and problems. And I had migraines and abdominal pain and asthma and terrible environmental allergies, really, really horrible environmental allergies. And when I started getting more and more injuries, I realized as a teenager, I need a plan B. So, I don't know if I'm going to make it as a, long career in dance if I'm already having so many injuries. And I had multiple surgeries in high school. And I spent a fair bit of that in my early years in college in a cast and on crutches and things like that. So I decided that I would go into medicine, which also was another love of mine starting from a fairly early age, but that was not my first choice necessarily. And so went to medical school, worked for quite a few years as an anesthesiologist in the operating room, which I did really love, even though it was obviously very challenging. But then my own health started to catch up with me again, and I needed to come up with a plan C. So I wrote my article on pain management and hypermobility disorders for a CME journal. And people started to email me and ask me, where can I come see you? And I had to say nowhere because I didn't have a clinic or anything at that time. And one of my mentors, Dr. Pradeep Chopra, actually talked me into opening a clinic. He's an anesthesiologist. And he said, as anesthesiologists, we are trained in the cardiovascular system, the respiratory system, immune system, all of these things. And we understand pharmacology and physiology. So, it's not a huge leap for you to go into that type of practice. So I did open my first clinic late in 2017, and I've been seeing patients ever since. My medical practice is pretty small because I spend a lot of time on my podcast.
Gotcha. Where in this journey did you get your diagnosis? I know it's for a lot of times we spend years.
Yes, years. So I kept telling my PCP, there's something wrong with me. I get injured way too easily. And this is in 2010, 2011. I had Tarlov cyst surgery in 2011 on 8/11/11, so it's easy to remember. And at that time, I still did not know that I had a connective tissue disorder. I came across a sentence that said people with Tarlov cysts, which are outpouching of the nerve roots in the spine, and they compress surrounding nerves. And that if you have that, you're at a higher risk of having a connective tissue disorder, or that people with connective tissue disorders are more likely to get these cysts. So I started reading about connective tissue disorders, and mind you, I'd been through medical school. I was working as an anesthesiologist. I had many, many years of medical training at this point, but I knew very little about Ehlers-Danlos syndromes because we're just not really taught about them in medical school. And so as I'm reading about this, I'm thinking, oh my gosh, this could explain my entire life, because I'm also reading about MCAS, or mast cell activation syndrome, and how you get allergic phenomena, inflammation, and what's called dystrophisms, or abnormal growths. And I had all three of those things.
Wow.
quite significantly. So I'm reading about this and I'm thinking, oh, this explains a lot. So I got my diagnosis in 2012. I saw a rheumatologist who fortunately did a very extensive evaluation and thorough physical exam because I no longer could touch my thumb to my forearm without hurting myself at that point. So it was very, very reassuring to know that there was something that could explain my lifelong symptoms. Made me feel very validated.
Sure. That's a long journey, though. So you didn't have any of that knowledge when you decided to kind of hang up the ballet shoes. You were already through med school. That's incredible. And I know sometimes a long trajectory is people's experience with chronic. And you're right. Then you kind of feel like there's suddenly an answer to all these things with the validation. That's amazing. So had you already... I know you said you opened your clinic in 2017. Was getting your diagnosis part of the impetus for now that you had a name and a focal point? And was that part of the impetus of you deciding specializing in this, or were they kind of hand in hand?
So I did go back to work after I had my spine surgery, and I was working at that time doing what's called locum tenens, which is like substitute teaching for doctors. So I was going to hospitals all over Wisconsin, which is where I lived at the time. And then I started getting pain in my wrist. And it turned out that I had a huge cyst inside a bone in my wrist, which is probably a mast cell connective tissue. There's not a ton of data on this, but it seems to make sense that if you have problems with your connective tissue, that would explain why you get this huge hole inside a bone. So I had to have bone grafting surgery on my wrist.
Wow.
And after I got that surgery, I got CRPS, or complex regional pain syndrome. And I was not able to go back to work like I expected. My younger son was going to be going off to college soon. So I also knew that surgery was in January of 2016. So I also knew I need to do something or else I'm going to get so depressed. I'm going to be sitting at home feeling sorry for myself, and I'm going to be so bored. So I was still going to anesthesia conferences, even though I was, disabled from the OR. I was still going to anesthesia conferences and trying to learn everything I can. And I remember sitting in one of the lectures at this anesthesia conference and thinking, oh my gosh, these doctors are doing incredible research. They're really trying to help patients. And patients are over here thinking, nobody cares. Nobody wants to help me. And somebody has to bridge that gap. And I realized too that having a podcast allows people to learn what's going on in the fields of research and in other spaces in a way that doesn't need to take up time in a one-to-one encounter. And your doctor may not know those things anyway. Like when I was working full-time, raising children, I didn't have the time to do the kind of research and things that I do now. So my job looks very, very different now than it did when I was working in the operating room.
Yeah, and now the autoimmune diseases are becoming, more prevalent. More people seem to have them, and more conversation and information is around them. It seems like there's new information coming out every day. So it would be a full-time job alone just to stay on top of the most recent studies and the different diseases. They're so nuanced and vast as I continue to learn. That's amazing. Well,
yes,
bridging the gap. So you specialize in performing arts medicine, where I'm assuming there's a fair amount of crossover with hypermobility challenges. Can you share about that? What your patient profile looks like? How does somebody end up in your office?
So I have a wide variety of patients. I have patients who, and clients, by the way, and I can explain the difference between the two in a second. So I have patients and clients who are quite healthy and they want to be proactive, and they're like, I know I'm hypermobile, which means the joint has greater than normal or greater than expected range of motion. I know that I'm hypermobile. I want to be on top of things. I want to make sure that I know what to look for. And so they're managing quite well. So they could be a dancer. Maybe they're not a dancer. Like it could be, a musician, somebody who does sports, anything, or they're just not doing any of those things, but they're just wanting to be proactive. So I see people like that. And then I see people that are really, really, really sick. They might be on tube feedings, like they can't even be fed through their gut or through their intestinal tract. They're actually being fed through their veins with chemicals through their veins. That's how sick they are. So, and everything in between. So it's a whole massive spectrum, actually. And so I do see a number of dancers. I've seen a number of professional ballet dancers. I think ballet more than others because of a couple of reasons. One, because I'm so passionate about ballet, and I've done a lot of podcast interviews about ballet because I want to reach people sooner. I want people to understand as early as possible that if you're hypermobile, there are things you can do. This narrative of, there's nothing you can do is so harmful. So I want people to be aware of what to look for, what they can do, how to take the best care of their bodies. And whether you're a professional or a pre-professional or just doing ballet for fun or some other form of dance, it's really, really important. And I've spoken at, contemporary dance schools as well. So I do have, patients and clients that are dancers. I have lots that are not dancers. I don't have as many musicians, probably because I'm not a musician. And so I don't understand, even though I did go through that certification process, I don't understand as well or relate to them quite as well. But I do love taking care of any of those kinds of people. I do want to briefly explain the difference between a patient and a client. So I'm licensed in Wisconsin and Colorado, and medical licenses are state dependent. At the beginning of COVID, it was great. You could get emergency medical licenses for all kinds of different states, and it was super easy. And just that was a really wonderful thing because I could offer care to a wider number of people. And you didn't have to see them in person for your first appointment, which has pros and cons for sure. I think in-person appointments are really, really important. So in order to become a patient of mine, as it stands currently, I have to see you in person for your first appointment in Wisconsin or Colorado, which are the two states I'm licensed in. And then after that, I can see you virtually so long as you're sitting in Wisconsin or Colorado, two of the states I'm licensed in. If you cannot do those things, which of course there's a lot of people that cannot, I've seen people, from the Netherlands and Ireland and Israel and Italy and, all over the world, Korea. I can see those people virtually, but they don't become a patient. So it's kind of like doing a one-on-one lecture, kind of like we're talking about now, but it's more customized to them. But it's not, you should do blank. It's people with blank often benefit from blank. So I do have people that meet those criteria as well. And I started doing that in 2022 because I realized there was this huge gap where people wanted one-on-one access, but they could not get on a plane and come to see me in Colorado or Wisconsin.
Sure. What you do seems very specialized. Well, I love that you have it's like a two-prong approach. You're trying to get more accurate information out there in your podcast. I know for me, when I was bedridden essentially with my autoimmune, podcasts were a tremendous source of great information. Facebook groups can help sometimes, but you don't get to moderate. You don't know who the information is coming from. I mean, the quality of information here is so important. And so podcasts were a huge tool for me. And then you're giving specialized care to people one-on-one in these two different parameters. What kinds of guests do you have on your podcast, and what kinds of topics do you cover?
Yeah, I love that question because in the beginning, I did a lot of dance medicine type topics. My co-host was the amazing Jennifer Milner, who is a former professional dancer and Pilates instructor and works a ton with the hypermobile population. So she and I interviewed physical therapists and psychologists and a whole range of people, immunologists and geneticists, like a whole bunch of different types of people. And some of those episodes were very focused on performing artists because, again, they're very high risk. They have a much greater percentage of people that are in performing arts have joint hypermobility than in the general population. So that's why I was really kind of targeting that population because I wanted them to have this information. Then around season 4, I started to shift it to even more medical topics. And now I think are we technically in season 6? Or I'm not sure. I started in 2020. And so we are going to be publishing our 200th episode in the very near future.
Congratulations.
Which I'm very excited about. And thank you. Thank you. I'm very excited about that. And I love having a podcast because when I want to learn about something, I invite the person on. And so I get to have this great conversation with them, but also other people get to listen in, right? So I recently talked to someone who happens to be in my backyard. He's a radiologist and he practices interventional radiology. So he specializes in CSF leaks. And I love that, we got to have this great conversation, but everyone else got to listen in and hear, what are the things that clinicians should be looking for? What exactly should we put on the requisition slip? What kind of treatments are available? How do they decide where to do the blood patch, et cetera? So it's really, mostly now medical specialists to cover topics that I think are relevant to the hypermobile population and people who have connective tissue disorders and comorbidities like POTS, postural orthostatic tachycardia syndrome, and MCAS, or mast cell activation syndrome.
Wow, amazing. And so real quick, let's just cover these. I assume somebody tuning in probably has one of these or thinks they might. It's very specialized, but POTS, can you tell people can we touch on each one and just give a little definition or how that might show up in the body? So if people are wondering, hey, is this a hat I'm wearing? They would tune in.
Right. Yeah. And that's why with the podcast, I'm really trying to cast the biggest possible net, because if you add all these conditions together, which they overlap quite frequently, but if you add them all together, especially now with this post-COVID era, or obviously people still get COVID, but it's actually a lot of people that are potentially impacted, a very, very large percentage of people. So it's really important that people understand what these things are. So yes, POTS, postural orthostatic tachycardia syndrome. Basically, you have to have symptoms for at least 3 months. So this is not, you got the flu and then you just don't feel good when you stand up because you're deconditioned or you're dehydrated. So, any of us, if we're dehydrated, when we go from sitting to standing, we might get dizzy, shades coming in, et cetera. But if you have POTS, your autonomic nervous system, and that's the nervous system that controls everything you don't think about. So your blood pressure, your heart rate, your breathing, your digestion, the size of your pupils, your temperature regulation, et cetera. It means that is not functioning well, and you don't do well with upright posture. So people who, they can't stand in line, they start getting twitchy because they feel like they're going to pass out. You don't have to pass out in order to have POTS. That's a very, very important point. A lot of people think that you do, and you do not. So it's a constellation of symptoms. And unfortunately, the name implies, and also there is diagnostic criteria associated with a change in heart rate. It has to change by 30 beats per minute. If you're over age 19 or if you're under age 19, it has to increase by 40 beats per minute when you go from laying down to standing up. And it has to be sustained, not just a single measurement, but it's not a heart rate problem. It is a nervous system problem.
That makes sense. Okay. So that's POTS. And then Ehlers-Danlos syndrome. Could you give us a little bit more of a deep dive in that?
Yep. So the Ehlers-Danlos syndromes are a group of conditions that involve the connective tissue and other components of what's called the extracellular matrix. So this is like the glue that holds the body together. So if you think about it, it makes sense that if you have problems with your connective tissue, that it's going to affect your entire body. So this is not a musculoskeletal, alone condition. It is a system-wide condition. Or conditions, I should say. So there are the more rare types, which can be extremely rare. Some of those subtypes of Ehlers-Danlos are very, very rare. And then the hypermobile type is by far the most common type. And that is probably accounts for, 90% or more of cases. And there's been a lot of discussion over, should we still be lumping these together? Should we, what kind of criteria should we be using in order to diagnose the hypermobile type? There is no genetic marker for the hypermobile type or for HSD, which is hypermobility spectrum disorders. So hypermobility spectrum disorders means that a person has signs and symptoms related to their joint hypermobility, but they don't meet the diagnostic criteria for another condition to explain their symptoms. The core features of the Ehlers-Danlos syndromes are, number one, joint hypermobility. So that's joints with greater than expected range of motion. Number two, tissue fragility. So, you can get pelvic organ prolapse, you can get hernias, and things like that. And then changes in your skin. So it could be stretchy skin, abnormal scarring in the skin, things like that. So that's the Ehlers-Danlos syndromes.
And I understand that there's 3 that can often appear as a trifecta: the Ehlers-Danlos, the POTS, and then the third one, the MCAS. Is that correct? They're often bundled, as they say. Can you tell us a little bit about MCAS?
Yeah. Yes, if you have hypermobile EDS or HSD and POTS, the chances of you having mast cell activation syndrome are about, according to this one study, about 35-fold greater.
Wow.
35-fold. So, when we look at studies, people will say, 10% higher, whatever. We're talking 35-fold higher. So this is a huge increase. Okay. So mast cell activation syndrome. So mast cells are a part of the immune system, and they are there to react to pathogens, so bacterial infections, viral infections, tick-borne infections, and chemical exposures, mold, other things in the environment that might be, assaulting our immune system and our nervous system. But when somebody has mast cell activation syndrome, those mast cells are hyperactive. So instead of reacting normally and just having like appropriate reactions, they start to react to a lot of things. So this is the person who, can't walk down the detergent aisle at Target because they start to react. They react to people, wearing perfume, or, they get a piece of furniture delivered and it makes them sick because it's off-gassing. So mast cell activation syndrome is really tricky because it presents in a wide variety of ways. And it makes sense, though, if you think about it, because mast cells have thousands of mediators. So it depends on what kind of mediators are being released. So one person might have more of a GI type presentation. Another person is going to have more like skin. Another person might have more pulmonary, but you need to have at least two systems affected. So, again, there's all these different systems in the body. And for a mast cell activation syndrome diagnosis, you do have to have at least two systems being affected.
Okay, that makes sense. Great. And then you have a lot of resources to help people deep dive into this information. You have the podcast, Bendy Bodies, and on your website, will you share your web? I'll put it in the show notes, but for people who are driving, would you share your website for us?
Yes, absolutely. It's hypermobilitymd.com. And we're actually in the middle of revamping the website. So hopefully by the time this is posted, we will have the new website up with FAQs about EDS specifically so that people can get some of the answers directly there as well. And I also have a newsletter on Substack, which is hypermobilitymd.substack.com. And I love Substack because it allows you to, first of all, write much longer things. And also it allows you to go back in and edit if you want. So let's say some new piece of information comes out, or somebody says to me, oh, hey, I do this special thing with cromolyn, or, they give me kind of a hack. I can go back in and I put at the top that I edited on a particular date, and I put in that change, and that way people can see, an update. So I really like it because it allows for some of the more nuanced information to be written in a very thoughtful way as compared to, I feel like, a lot of social media posts. It's really hard to incorporate that.
Yeah, there's a difference between like influencing and educating. I mean, I know they can go hand in hand, but if you're very education driven, the ability to revise things is part of education because we're always learning, right? Well, how can people join your newsletter? You said it's on Substack. Do they go to your website? Do they go to Substack?
Substack. They could do either one.
Okay. I was going to say, if I don't know computers very well and I'm like, I want to go join her newsletter to tell us how we get there.
Right. So you could go to substack.com and search for the Bendy Bulletin, or you can type in hypermobilitymd.substack.com in that bar where it shows the address for the website. But Substack has lots of great authors now. So it's really, I think, a great resource for lots of topics. I mean, there's a ton of people publishing there about, immune conditions. And I feel like there's more and more, doctors, PhDs, people with, credentials and good scientific information that are taking the time to write on there.
That's fantastic. Thank you. I'm not a member. I noticed some people I follow, they'll say, follow me at Substack, but I just didn't really understand what that was. And it's Bendy Bulletin.
The Bendy Bulletin. So Substack is a platform for writers, and it allows people to create their own newsletter, and you can follow the person, you can subscribe. Some people have like different levels. So I have different levels. Like there's a lot of information for free. I do have a paid tier though also. And it just allows people to be able to share what they're working on, and you can make notes, you can publish actual like longer posts. It's really great. And I did I've done one live on there. I need to do another one, but you can do live streams on there also.
Fantastic. Cool. Thank you for that. That's great. I love podcasts on YouTube, but sometimes it's hard because the algorithm's always wanting to show you what you should be watching. If you're trying to find a specific topic, sometimes it's a little hard. Even trying to go back to a podcast I've already watched, I'll be like, which podcast did they cover that thing where they talked about this? So that sounds a lot more user-friendly in that way on Substack.
Yeah. They give us all these suggestions, and it's like, oh my gosh, I want to listen to all of those and watch all of those. And yes, it can be really challenging, which reminds me, if people follow my YouTube channel, which I hope that they do, it's the Bendy Bodies podcast on YouTube. There is a way to click the bell icon and I think there's different choices. And I think one of them is like all notifications. If you do that, then you do get notified, I believe, of like future episodes and things like that. So
okay. Fantastic.
Yeah, that's important.
Fantastic. And I know you're on YouTube and Spotify because I checked you out there. What other platforms can people find your podcast?
All of them. Yeah. I have a production team and they are very good about once you have your RSS, right, it just pushes out to everywhere.
It pushes out to everybody.
It's on, I don't know if there's, Pandora and, of course, Apple Podcast and Google Podcast. And I mean, it's a lot of places.
All the things. Okay. Perfect. Thank you so much.
Yeah.
Gosh, we're coming up on time. This went so fast. Do you have any kind of parting words for somebody who is maybe sitting here trying to learn about this condition, trying to evaluate, if maybe they have it? Do you have any suggestions for them?
I would say my biggest suggestion is get informed. Don't give up. There is hope. It's so, so important to educate yourself and take ownership of your own health because unfortunately, most doctors don't have the time to learn about these conditions and be able to provide resources. And I keep telling people you don't have to be an expert, just learn enough about them so that you can provide the resources and refer people out to other specialists. But there's a lot you can do on your own. There's a lot you can do without a prescription, without a doctor writing you prescriptions. So again, that's why I'm so passionate about the podcast and why I've shifted into spending so much time on my podcast, because I want people to have these tools and not have to spend their precious, valuable one-on-one time with their doctors, on some of these things that maybe they can try out on their own and do on their own, and also not be getting told, well, there's nothing that you can do.
Right.
And you can educate your doctors, well, there's this podcast called Bendy Bodies, and I learned about these things, and there's so much low-hanging fruit. I learned about these, high benefit, low risk things that I could try. And, again, it's not medical advice, it's information, but it's information for people with these conditions that they might not get elsewhere.
Perfect. I love that so much. You're right. There's a lot of things that we have agency over that we can start doing once we have the right education, implementing to feel better, and then bringing our doctors along in a two-way conversation to keep bringing things up. Sounds great. And then people can work with you, right? If they're ready to go directly with some help.
Yeah. If they want to work with me, they can go to hypermobilitymd.com. I do have, honestly, a very long wait list to become a patient. But when I work with people as a client, I feel like there's so often so many things that they can try, and maybe they don't have to then get on a plane, pay for a hotel room and all of that stuff. And I do also have a PA that I hired for Bendy Bodies to help with the coaching, and her name is Rebecca Gluck, and she is fantastic. And people are really loving working with her also. And so the wait list for that for me is often a lot longer, but getting in with Rebecca is a lot easier. So I highly encourage people to do that while she still has sessions available, because she's going to get busier and busier.
Then she's going to have a wait list. So perfect.
Exactly. Yes.
Well, thank you so much for making time for us today. I know you have so many things going on. It's incredible. And thank you for sharing this information. We'll link everything below. Please go check out her myriad of amazing resources if you think one of these conditions applies to you or somebody that you love. And thank you for tuning in to the Bouncing Back podcast. We'll be back in 2 more weeks with more inspiring stories of success. Please also rate, review, and share this podcast. It helps us so much. So until then, keep bouncing back.
If these stories of strength and comeback hit home, you'll want to hear what's next. Click the video on screen to keep learning from our incredible guests on how to bounce back and thrive.